on mental health, what is, what isn't, take some questions, see what happens in this hour. Again, the purpose of these broadcasts are webcasts are to just, continue with the idea that our mental illness, our mental health is really something that we all need to be working on. I'm going to start each show with a little bit of that type of motivational talk that we need to work on our issues. We need to be in a situation where we're okay with working on what's on our mind. So I want, as people log on, I just want to address a couple questions that came in comments. The way I interact with people is the way they interact with me. So if somebody comes at me in a very aggressive, rude way, odds are I'm going to come back at you in a similar way. If you come back to me in a very, mature way, you want to pick a bone with something I've said or advocating, feel free. But I'm not going to allow people to just, again, say whatever they want without me responding in a way that, I feel is appropriate. But anyway, this isn't one of them. Jennifer had taken exception to something I said in a previous broadcast when I invoked Donald Trump as a example of somebody that I feel doesn't have a lot of empathy. So she wrote, invoking Trump ruined your segment for me. So we exchanged a few back and forth. She never started calling names. She was never rude, which is great. And by the way, if you're watching this now, please ask me a question. But, we had a little good back and forth. And then Jennifer, at the end of it, asked me a great question, actually, which is something I've been meaning to touch on. Can a job create narcissistic behavior? So the question basically is, what I'm guessing is Jennifer, is a Trump supporter and didn't like my contention that he doesn't have a lot of empathy. He doesn't, and this is prior to, people think Donald Trump just magically appeared on the scene. Many people who have known about Trump, I've lived in New York City, this isn't anything new. So, but anyway, the point is, can narcissistic behavior, because I think part of the last segment was everyone saying that Trump's a narcissist, but can a job create narcissistic behavior? Great question. So she didn't respond, but I said, it's the nature versus nurture idea. And this is something integral to what I try to help people work on. Is we all, like I was working with a client today and he kept saying, I'm the type of person. And we all say that. We all, a lot of people say that I'm the type of person but in reality, until you start looking at how your beliefs got created, you're not going to really know what type of person you are. Because with Jennifer's question, and again, if you're watching this, please share it or ask me a question. This isn't just about me talking. I can fill up hours of talking, and that is not going to be why I started this. Hey, Diego, what's up, man? Diego saying, Doctor, I missed the Friday cast, but heard it over the weekend, and narcissism topic hit deep regarding my brother. Perfect description. Great. Hold that. I want to find out how you're doing, Diego, too. But nature versus nurture. So the question Jennifer was asking was, can somebody who's not a narcissist be turned into a narcissist by what they do for work? Now, anything's possible, but generally speaking, power brings out who you are as a person. So when somebody already has a certain personality inclination, so to speak, let's say towards narcissism, no, the job's not going to create them. They're not going to, or the job's going to enhance that. Somebody who doesn't have that, somebody who goes into the job with not a lot of narcissistic, has a lot of empathy, the job's going to create that. So the bigger issue here is the idea of nature versus nurture. And I'm just going to assume everybody knows that. So I'll give a quick 10-second description. Nature is And in psychology, we call it state or trait. And, Tony Robbins has made millions, co-opting a psychological term, which is change your state. So anyway, state or trait. So is it a state of mind? Like, am I just in that state of mind? Or is this a character trait? Nature versus nurture is one of the things I work intently with people on, because what I'm finding after more than 20 years of doing this is that the majority of what people think is their nature is actually their nurture. So meaning how they were raised. Diego's a good example of this. In a previous show, he was talking about how his father, was very aggressive and trained him to be a certain type of man and a certain type of father. Diego's not alone. My father did it to me. All of our parents do it to us. One of the things I try to help people do is start questioning those underlying beliefs. People have this idea of what psychologists and counselors and mental health and therapy and psychotherapy and all that is. It's not this spooky kind of, oh God, what's going to happen kind of feeling. It's literally sitting down and working on what the hell is troubling you, what you've been keeping in for years and years and years, what you've been bottling up, what you've been telling yourself is who you are. So when I talk about nature versus nurture, what I'm talking about is asking yourself, is this really me? Is this really who I am? And people would say, well, why is that important? Well, why is that important? Let's take the idea of racism. Like I said before, there are no racist babies. My 4-year-old kid doesn't have a racist bone in his body. Now, if I go and tell him, hey man, you don't play with black people, don't play with white people, whatever it may be, he's going to ingest that and start learning that that's what is correct behavior. So when you're looking at your nature or your nurture, you got to start first with your nurture, because your conditioning is going to give you an idea of who you are on a surface level. The deeper, what they call the authentic self, is that part of you that you've layered over after years and years of learning who you are. So, sorry, Jennifer's question is spot on. Can a job create narcissistic behavior? I'm going to err more on the side of no. Taking, for example, if I became the president, I tend to be more on the empathetic side, where I am very concerned with how I'm affecting people. It's sometimes I take it a little bit too far, as my wife reminds me, but me getting a whole bunch of power, I'm just going to try to empower people with that. I'm going to try to do what I can to help people empower themselves. I'm not going to take that power and be like, yeah, I'm the king. So I don't really, yes, can a job bring out underlying narcissism that may not have been there? Yeah, it's possible. But in general, no. Jobs like the presidency or powerful positions that people have bring out who you really are. Okay, Jennifer, so I hope that answered your question. Thanks again for having a mature back-to-back with no name calling and all that. Very much appreciated. And by the way, I posted a link to a group I had started months, probably a year ago, that I never really had trying to develop. It's called Finding Common Ground. If you go to the Facebook page of mine, you can join the group. And it's basically just a group where people can join this group and discuss issues in a safe environment where there's not going to be any name calling. There's not going to be any putting down. I welcome people from opposite sides of the political spectrum, religious spectrum, whatever it may be. The only rule is you got to be empathetic. You have to find something about what the person is saying that you can agree with. So check it out on my webpage. It's on my Facebook page if you want to join. So getting back to Diego's question. So um, narcissism topic hit deep for him regarding his brother. Perfect description. So yeah, Diego, I mean, it sounds like, you guys were growing up in an environment where you had a male role model, not putting your dad down at all, but you had a male role model who was all about, that male machismo, be a strong man, don't worry too much about how people, you, how you affect people and things like that. So it's good that you're looking at that, Diego, because a lot of that fuels addiction. A lot of my work with addicts, and I'm not saying you're an addict, but people who struggle with an addiction, they have this idea that they're either invincible, or that's not going to happen to them, or they can manage it, even when people around them are telling you, honey, you got an issue here, dude. I mean, you got to work on this. So Diego is a good example of somebody who is beginning to wake up, who is beginning to say, so now he's saying, I am well and much better. The communication with the family by gathering them was a wonderful start. Excellent, my brother, and much more better. Our lives are much better. My next question I have to move forward is, what is the next step to make a habit to be better? And yes, my brother was raised by my mother and me amongst men, so that sums it up. Yeah. So what do you mean, Diego, when you say, what is the next step to make a habit to be better? So I'm guessing that it's what we've been talking about in some previous shows, where you're talking about having an issue with substance abuse, having an issue with your marriage. The best thing I would encourage you to do at this point, Diego, is you got to start talking to yourself, man. You got to start asking yourself. I'm 55 years old. You look like you're probably in your mid-20s. I would say to you, what am I going to do if I don't make a change now? What am I going to look like in my mid-50s? What's my life going to look like? Am I going to look back on my life and say, why didn't I do X, Y, Z? And if you genuinely can say, Diego, that you would do that, you got to start making small steps forward now. And if it is something where you're drinking too much or doing too much drugs or smoking too much weed or whatever it may be, you got to look at how your culture, your nurture, okay, the environment around you is perpetuating the behavior. I had a client that I was working with who came from, his background was from Russia. And this individual obviously had a lot of that drilled into him about what it means to be a Russian man. So he struggled a lot with addiction and issues about self-esteem. Now, he's done amazing, amazing work, and he's sobered up, got clean, working through some other issues so we can get him to another point. But the point about addiction is, a lot of times addiction is held together by the world, the environment around us. We don't like to admit, people in general, men especially, don't like to admit that they're wrong, that they need help, or that there's something that needs attention in their life. So this is why one of the things, I did my doctoral dissertation on, I don't know if you guys have heard this gentleman called Viktor Frankl. If you ever want to pick up a great book, Man's Search for Meaning, great book, but it was about how to find meaning, how to help clients find meaning. So, hi, Severina, thank you. I'll get to your question in a second. One of the things you have to do when you're trying to make a habit or make a habit be better, you got to look at what's holding the habit together, brother. You got to look at why has this become a habit? What is this habit keeping together for me? So let's take, for example, let's say you have a gambling addiction or an alcohol addiction. People with these types of addictions aren't looking at what's keeping that addiction together. They don't want to look at what is contributing to the addiction. And what I would encourage you to do, Diego, is start the process of questioning, why do I need this substance? I mean, why am I need this? He says, I'm 48. Well, you look good, brother. Only alcohol, and I understand your examples. Great. Well, good, dude. So then if it is alcohol, Diego, you got to look at, let me tell you something, man. or people watching this, please, again, if you have a question or comment, please make it. Please share this. Bring in people to the discussion on mental health, mental illness. But alcohol, there's one reason alcohol is in our culture. Dollar bill, y'all. That's it. That is all it is. People, the alcohol companies could care less about the public health nightmare alcohol causes in our culture. Look at all these gambling websites now, all these I don't know, what are the, place a bet. All they're after is money. They don't care about anything else until people wake up and ask themselves, again, nature versus nurture, where did I learn that I need alcohol to have a good time? Where did I learn that alcohol is something that I have to have, or if I don't have it, this movie would be great, but it'd be better if I was buzzed. Or this party is great, but it'd be better if I was drunk. Why? Why do we need more dopamine in our system to feel like things are better? Dopamine exists in our brain for a specific reason. It isn't to be continually cranked on. And people need to ask themselves, why am I the way I am? Why do I do what I do? So Diego, let me get to some other questions. I'll come back to you if you want. But my advice to you, my brother, is keep moving forward with the life you want. If that is a life closer to your family without alcohol, and you got your friends telling you, come on, man, what are you, a little, blank? And dude, screw them, man. Excuse my language, but your main priority at this point isn't to your homies. It's to your wife, your kid. These are the people in your life that are going to have your back. I can't tell you guys how many times I've worked in prisons and worked with inmates who say, damn, man, no one's coming in here putting money on my books. All my homies have just turned my back on me. So all I'm saying to you, bro, is keep moving forward with getting healthy. I'm not saying be a monk. I'm not saying that. Okay. Trust me, I've had my run-ins with things in my younger days, but what I've found is that all of that is pure conditioning, pure nurture, pure the idea that we need alcohol. We need it. I saw it growing up in my own family. My father drank every night, almost every night. So I saw the effects it had not only on him, our relationship. He never got to see his grandkid. He died in his early 70s. So good, Diego. Keep questioning why you're doing what you're doing, okay? So let me just get to Severina's asking a great question. Let me get to Angie first. So Angie is saying, my therapist is having to stop counseling because hours have been cut. Yeah, I really dislike trying to find a new therapist. I feel like I have to start over every time and build a relationship with a therapist before I can safely open up completely. I feel you, Angie. I do. People don't get what we go through with these insurance companies. These insurance companies not all of them are bad. And I'm not going to run them down here because, we do a lot of insurance billing, but the insurance companies are up against their own problems with having to turn a profit and be profitable and all of this. Managed healthcare is probably going on. I don't know what your therapist is telling you to have to stop counseling because hours have been cut. I don't know really what that means, but what I would recommend would be, have your therapist talk to your new therapist. Have the therapist bring the new person up to speed on what's going on, what you've already worked on and where you want to go. Angie, take an active role with the new therapist. Sit the therapist down and say, look, this is what I've worked on, and go through a series of things that you feel you've worked on. Go through a series of things you feel you haven't worked on. Go in there with the attitude. Like I tell people all the time, think of me as a crescent wrench or as a pair of pliers. You got to use me the way you need in order to maximize your effectiveness. I don't want my clients getting dependent on me. I want them beginning to depend on their own ability to heal. So what I would recommend to you, Angie, is ask your therapist, if you're going to find a new one, to at least speak to, or maybe write up just a narrative, not, I don't know if you have to ask for all your records and all of that, because that's just another thing that bogs down our ability to help people. Everyone wants records. Everyone wants this. And most of us, like me, I'm a mom and pop operation. I do all the therapy. My wife does all the billing. When we get these record requests, I can't take on new patients. So maybe just talk to your outgoing therapist. Like, look, what can you do to help me with the new person get up to speed so I don't have to waste time, and worry about that. And another thing, Angie, yes, goodness of fit, you're absolutely right. You have to feel comfortable with who you're working with, and that will take a couple sessions or even maybe your first gut instinct with the person. Okay, so I hope that helps. Feel free to ask me some other things. So I want to get to Severina. I hope you're still on. I got out of a relationship with a narcissist, and it is taking a lot to trust and get out of the hole. Any advice? Yes. Here's my advice, okay? Give yourself some credit, okay? Talk to yourself in a way you would talk to a girlfriend, saying things like, great job, honey. I'm proud of you. You did the right thing. You got to work on your relationship with yourself, Severina. The thing, and it's, again, this came up with a client today. Same thing, just got out of a relationship with a narcissist. Now a non-intimate relationship, but the person is exhibiting similar traits. So it sparked a lot of that reaction. So after we kind of calmed things down a little bit, the person was able to then go and talk to the person and talk some things out. And now the other person knows where the boundaries are. So what I would advise you, Severina, is this, okay? Don't look at trust, and I said this in a previous webcast. Don't look at trust as an all or nothing. Okay, this is one of the main mistakes people say, and I hear this all the time. It's trusted. You either trust someone or you don't. If there's no trust, there's no relationship. Sorry, BS. It doesn't work that way. There are degrees of trust. What I would encourage you to do is to start trusting your own instincts, okay? You have, once the wound starts healing from whatever this person inflicted upon you, you've got to start looking at it like, okay, what did I learn from this? What did I learn from this? Everybody knows about post-traumatic stress disorder, of course, PTSD. Not many people know about PTG. And look all this up online, post-traumatic growth. How do I want to grow from this? You've got to be actively involved, Severina, with your healing. So what that means is you've got to stop framing. And I don't mean let it go, stop. I don't mean like that kind of stop. I mean slowly begin to let go of the belief, meaning changing the frame of this relationship you got out of as, oh God, I'm never going to be able to trust anybody again. I don't know if you're gay or straight, but I'm just going to go with straight. I'm never going to be able to trust men again. I'm never going to be able to do that. You got to stop saying that crap to yourself. Okay. You got to be, I'm just going to see if you followed up with anything here. Okay. I am here. Great. You've got to stop saying things to yourself like that. Like, I'm never going to be able to trust again. I'm never going to be able to have a relationship again. Think about it like this, Severina. If you had a friend of yours who had gone through what you've gone through, you wouldn't say that crap to them. You wouldn't say to your girlfriend, "Oh, you're never going to get out of the hole. You're never going to trust anybody again." You wouldn't say that to them. Why? Because how would it affect them? Well, you're saying it to yourself. So the main thing Severina has to say to herself is, I am going to grow from this. I am going to take this. And by the way, please share this broadcast. If you're watching this, Dennis, how you doing, Dennis? I'll get to you in a sec. If you're watching this, please don't be ashamed of sharing this on your timeline. It's the same thing as if you're working on your physical health. Nothing wrong with mental health. Severina has to start empowering herself by framing. So framing is a psychological term where you put a meaning around something. Okay. So and that's where beliefs and conditioning and nature versus nurture comes in. So framing is Severina has to say to herself, I am going to frame this relationship I got out of with this narcissist as something that's going to help me grow. I'm going to learn from this. That mother blanker is not going to affect my ability to trust other people. I'm going to trust somebody else. You've got to start empowering yourself, Severina, with your self-talk. You have to start believing, I am going to heal from this. I am going to get through this. Part of depression and part of trauma is it just bombards us with pessimism. It just bombards us with feelings like, oh God, I'm never going to get out of this. I just lost who I am. I don't even know who I am anymore. Who wants me? No man or woman's going to. I'm damaged goods. I'm never. And that's the kind of self-talk, sister, that is going to keep you stuck. The other thing I would highly recommend, if you haven't done it already, you got to get with somebody trained, licensed, and talk things out of you. You've got to talk out some of that pain, some of that hurt. You can't keep that inside of you, Severina. You keep that inside of you. It's like eating something bad and your body wants to puke it out, excuse my frankness, but you hold it in. It's going to make you sicker. It's the same thing with emotional wounds and emotional pain. People have this idea that talking things out with somebody like me, a counselor, whoever it may be, means that you're crazy or means that you're weak. Again, who the hell do we know that isn't weak? Me? I got plenty of weaknesses. What's the matter with a little weakness? So again, Severina, I hope that helped. Let me just see if you have any follow-up questions. But you've got to be working on, you've got to work on that pain, okay? You've got to work on that pain. If you don't, it's going to work on you, all right? So Dennis, hey, how you doing? She had another episode tonight, drinking with her friends, and she got a little violent, so I left the house. Damn, dude. I believe she's really having a serious emotional breakdown. Yeah, man. Dennis has been in and out of our the shows for a while. He's going through a lot, so it's difficult, Dennis. Do we know what the breakdown is stemming from? Do we know why she started drinking again? Did you guys get into it? One of the things I would recommend for you, Dennis, is you may want to start looking into your own healing through some sort of support group for, husbands or family members of substance abuse people. They're all out there. Okay. They're all out there. They've got plenty of support groups. You might want to just sit her down after she sobers up or whatever tomorrow and just empathize with her. Like, honey, what's going on? I'm worried about you're having a breakdown. What is happening? Try to, I know we talked about in a previous show that the emotional connection with you guys isn't really there that strong anymore, but try to just empathize with her. Maybe that's what she's feeling. Maybe she feels your emotional disconnect and that's affecting her. But I would imagine that and I've been involved with people with pretty substantial substance abuse. It ain't easy. It ain't easy. Just when you think that things are going, boom, they relapse and it just sends your world into chaos. So what I would recommend for you, Dennis, is maybe you need to start talking out some of the things going on within you. How is this relationship affecting you? What is going on with you where you feel that you have to stay in this relationship even if it's negatively affecting you? You've got to be able to say to yourself, when is enough enough? And I know you guys have, I think you guys have kids and, no, she's having the emotional breakdown. Right. But why? What is going on with her? Okay, Severina saying, yeah, I got to the point that even my family did not recognize me. But remember, Severina, that's not your fault. Okay, you're a victim of abuse. So let's not bring shame into that. If they don't recognize who you are, then you have to say, okay, well, I need to work on that. I'll come back to that in a second. So Dennis is saying, I've been involved with people with pretty standard fellowshipping, great, and talking it out, but I don't think I could stay around much longer. Well, I would recommend that you guys have to sit down and figure out how you're going to proceed here. You've got to, Sinieta is saying, wow, so I didn't see your first comment. But Dennis, you're going to have to get to a point where you're asking yourself, what is keeping me in this marriage? What is keeping me in this relationship? And I know the idea that I'm married too, and for better or for worse, but we can't take that too far. So if she is not gonna work on her stuff and work on who she is, then you may have to sit her down at some point and you guys decide, what is the future here? What are we doing? And again, guys, thank you for all the questions that are coming in. Please share this. Please tell people about that there's this, crazy psychologist on the internet taking questions. Please. So please don't hesitate to ask a question. Hey, Melissa, great. That's great, Diego. Pull them in, man. That's excellent. So, but back to Dennis. So Dennis, yeah, I feel you, man. I know how this affects you. I don't know if you've got a drinking issue or whatever, or you guys used to drink together and you've sobered up. But my recommendation to you would be, when she gets sober, either tomorrow or the next day, that you guys have to sit down and figure out what's going on. And maybe she'll give you an insight. Maybe she'll give you a clue as to what you can do to maybe help her not hate herself so much, not be addicted to whatever she's doing, drinking or whatever. Okay. So again, please keep logging on, Dennis, keep updating us on what's going on. Don't hesitate to shoot me a private message or whatever, but we're there for you. A lot of us feel you. A lot of us have had people with substance abuse issues in our lives. We know how it can just rip you apart. And then you get angry. And then that anger fuels their drinking, because now you're screaming at them and they're not realizing how they're affecting you. And it just becomes a vicious cycle. So let us know how things go. But I would definitely recommend, if you guys aren't going to get into some counseling or aren't going to get into any kind of therapy where you're working together, then I would suggest you've got to set a time limit. You've got to set an amount of time and say to her, look, by Christmas, or I don't know, Thanksgiving, if this is continuing, we're going to have to talk about splitting up. Now, then you run the risk of pushing her even more into abusing something to deal with that pain and loss. I don't want to sound cold or callous, but sometimes we do need to do what's right for us. Okay, we do, because it's kind of like the analogy of a lifeguard going out to save somebody who's drowning. If that person is flailing at them and dragging them down and going to drown them, the first rule of lifeguarding is kick away from the person. Tell them, calm down. So you're going to have to, at some point, talk to her in a compassionate, kind way about what the next decision is for you guys' relationship. Okay. Hope that helped. Feel free to ask another question. Severina's saying, like I said before, you get to the point where the family didn't recognize me. Sister, you have nothing to be ashamed of. Okay. Abuse victims carry so much shame about, it feels like I betrayed myself. Okay, maybe, but Severina, when you're in an abusive relationship, you're staying in the abusive relationship for many reasons. I've said this before. People who tell people in abusive relationships, you're causing yourself to be abused, or they're blaming the victim. It's not that easy. I'm sure Severina and whoever this was, Severina, you probably had either or all strong emotional attachment, strong sexual attachment. Maybe you financially were dependent on the person. I don't know. But you did not betray yourself, okay? You actually saved yourself by getting out of it. The betrayal, Severina, and please hear me out here, the betrayal came from him, okay? He betrayed you. He abused you. You didn't cause the abuse. Now, maybe you did. I don't know. Maybe you punched him, or maybe you yelled at him a lot, or whatever. I'm not saying that. But even if you did do that, if there was any physical or emotional abuse, the person has to be responsible for how they're reacting. Okay. So, honestly, Severina, you got to work on your relationship with yourself. You really do. Because right now what I'm hearing is Severina is her own worst enemy. And that takes some work. None of that. I have 2 kids. Okay. Well, that could be the financial dependency. That could be the feeling that, how am I going to make it with these 2 kids? Or how am I going to split and not see the kids all the time. I don't know how old they are, but we all know that kids want mommy and daddy in the same house. Again, guys, please share this if you're watching this, please. So all of these are reasons that you stayed, Severina. You didn't betray yourself. You actually were loyal to yourself. Because if I was working with you, I would ask you, well, Severina, write me a list of five healthy reasons why you stayed in the relationship. You've got to be able to balance out this self-hate about staying in the relationship with the reality of what it feels like to be abused and emotionally beaten down. And a lot of these people who are narcissists, they will say the meanest blanking things, and then an hour or two later, oh, I didn't mean it, baby. Come on, or why did you made me do it? It's your, and then the cycle begins again. So Severina, you got to work on some of this stuff that's in your mind. You got to talk it out, and you got to get to a place where you feel comfortable just venting a lot of this. But the first thing I would encourage you to do, sister, is you got to stop hating on Severina. You got to start being Severina's ally here. You got to start talking to Severina the way you would talk to a friend of yours who's going through this. Hey, Toby, I didn't see your question. Okay, so again, feel free to shoot me some more questions. Let me just back up here and see if I missed anybody. Oh yeah, Arindira. Hey, Arindira. Arindira's been on a couple broadcasts before. Yes, I am in stage as well. It's solitude feels good. Yeah, Arindira talked before about how she's at a place now where she wants to be alone. She wants to be away from a relationship, and she's starting to feel good about that solitude. So yeah, maybe Severina can work on that too, because a lot of times people equate being alone with being a loser. Like there's this cultural conditioning that unless you have tons of friends and you're socializing all the time, there's something wrong with you. No, people need some time to themselves. People need some time to do what's called mindfulness, which is thinking about your thinking, being aware of what you're thinking. So that's great, Arindira. Thank you for the update. We appreciate that. Yes, it eats us up. It's like, I don't understand what this word is, but what you said makes sense. The negative input received affected my security in all areas. I don't know what low thyroid. Is that what that is? Okay. Oh, well, yeah, low thyroid. And that's something I encourage a lot of women to check on, is their thyroid, because you could have hypothyroid, which means you're just tired all the time, or hyperthyroid, where you feel like you're just frenetic. But yeah, so the negative input you receive from and by the way, guys, I don't say this like, please don't think my wife and I are immune to having our moments of negativity. We're not. We're like every other couple trying to make, we both didn't have the best childhoods, and that comes out in our relationship. So, but the thing that we have is a lot of love, empathy, caring, and we talk shit out, excuse my language, out all the time. We'll have a negative episode, and then we're talking about it on the other side. Hey, what did you really feel that way? I encourage all couples in conflict, once the conflict abates, don't stand on the other side of the mountain going, I don't want to stir it up again. Okay? You got to stir it up. Okay, think about making a cake. You got to stir it up to make the cake come together. Talk out the conflict. Don't argue about it. Go to the person. Look, I don't want to fight again, but you said some things that I need some clarity on. I want to hear what is going on. I mean, do you hate me? Are you just pissed at me? Talk out what comes out in the arguments, okay? Now, granted, a lot of that is fueled by anger, but there's truth that comes out sometimes, and you need some clarity. So Arindira is saying, yeah, the negative input received affected my security in all areas. So now that negative input's not there, so I'm hope whatever healing process Arindira is doing is about Arindira inputting positive, okay? Arindira, like I was saying to Severina before, inputting things like, okay, sister, you got this. We can do this. We're going to grow. Let's keep going. Let's get motivated. I can't impress upon you guys, again, please share this if you're watching it. I can't impress upon people enough the importance of optimism. Okay. Pessimism. I posted something a few weeks ago about, people say, well, I'm not being pessimistic. I'm being realistic. Excuse me? Why is pessimism realism, the only form of realism? I don't buy that crap for a second. Pessimism is a part of realism, but you know what is also a part of realism? Optimism. So we need to be optimistic that whatever trauma we're going through, we can get through. We can manage it. Okay, great job, Arendira. Keep us appraised of things. Melissa is asking, new viewer, Melissa, share it, please. Get your girlfriends to watch this, sister. Come on. She's talking about insecurities. So, did I miss Sinietta? Hold on. Let me go back here a minute. Thanks, Amanda, for helping out with Angie. Where is Sinietta's first comment? Did I miss it? Yeah, Sinietta said earlier, I found it hard trying to talk to a narcissist. Absolutely. One of the things about talking to narcissists is they only hear what's in their mind. There a lot of, again, remember, the key ingredient that makes somebody a narcissist, okay, is lack of empathy. Everybody has narcissistic qualities. Everybody has depressive qualities. Everybody has a touch of everything. There are certain things that you have to have a diagnosis of a narcissist. So sure, like Sinietta is saying, if you're talking to a narcissist, they're not listening because they only believe they're right. And a lot of times they could give a crap about how you feel. And if you genuinely feel, narcissism is now broken into all these subcategories and all that. That's all good and fine. But if you're with somebody that you genuinely feel does not give a crap about how you feel, you got to make a choice there, people. Either it is, okay, I'll just stay with this person and not expect much, and I'm going to have to give in a lot, or screw that. You can see I'm always editing myself because I do curse. Screw that. I am not going to subject myself to a situation where I'm with somebody who I feel doesn't care about me. So Toby is saying, if you don't work on your pain, it's going to work on you. Absolutely. That sounds familiar. Kidding. I'm doing homework, but this is saying caught to my attention. Great. So much truth in that. Great, Toby. Great. I'm glad it is, because that's exactly what happens, people. If we don't work on our pain, it works on us. If we don't work on these traumas, it's going to work on us. That's why I'm doing these broadcasts, okay? Because people need to look at mental illness as something that we all have. Yes, Yuri, this is live. Absolutely. If you're catching it on Twitter, this is absolutely live. So please send me a question. This is why I'm doing this, so people can engage with me. I'm a licensed clinical psychologist, over 20 years in the field. So your questions are important. So I don't know if Severina's still on, but she's saying, thank you so much. I enjoy being alone, listening to music, drive around. Yes, it's times that I feel down, but not for a long time. And when you're down, Severina, you got to, I don't know if this is your first broadcast, but other people have heard me say this. You got to take the It's Okay pill. The It's Okay pill is, it's okay that I'm down. I'm allowed to be down. Believe it or not, the illustrious Dr. Walker gets down. And there was a time where I'd been like, oh man, you're such a phony. I can't believe you get down. No, now I'm like, it's okay, dude. You're allowed to be down, but what's going on? Why are you down? Okay. So, getting back to Toby. Yes, exactly. If we don't work on our issues will work on us. But we live in this culture where people are ashamed to have issues. Remember, who do you know who doesn't have issues? Please share this. Who do you know that doesn't have issues? Name one person who you know, from people watching this, that doesn't have issues. Everyone has issues. That's why one of my domains name is everyonehasissues.com, because that is the truth. Now, there are degrees of issues, okay? Some people have issues that are like, God damn, those are some issues. And some people have issues at a different degree, just like their degrees of physical illness. People aren't ashamed to talk about their physical illness a lot of times. There is some of that, but it's not the same kind of shame. A lot of times people like, yeah, I got cirrhosis of the liver, or I have cancer, or whatever. But this is what we need to do with our whatever degree of mental illness we have. We have to say, this is a degree of mental illness. One of the things I'm still working on in my 50s is frustration when things don't go my way. Now, why is that a hard one for me to work on? If you all saw how I was raised, if you saw the environment where I was growing up with a father that was just losing his shit, excuse my language, every time something went wrong, every single time there was no calmness, there was no, it's okay, everybody. Let's stay calm and figure this out. So I find that I've got to constantly be monitoring how that's affecting my wife and son, because I don't want to pass that on to them. So that I'm able to say without any shame, yeah, I'm still working on some of anger, some of my anger management. And this is what we need to do, people. We need to work on our issues. So Melissa's asking, what about insecurities? So Melissa, I don't know what you mean by that, but I'm going to just go with what I think you mean by that. You may have insecurities, Melissa, that you're not comfortable with. So maybe there's some body image stuff you've got going on, or maybe there's some cultural things going on. I don't know. But everybody has insecurities. And one of the things that will keep insecurities getting worse is hating that you have insecurities, okay? If Melissa is hating her insecurities, then two things are happening, okay? One, and you saw me do this in a previous broadcast, and I've been doing this for years with patients to illustrate the point. In this hand, I have your insecurities, obviously a negative feeling. In this hand, I have hate. If you add hate to the negative emotion of an insecurity, you're going to expand it. You're going to deepen it. Okay. And then the second thing is going on, Melissa, is if you have insecurities and you're hating them, you ain't working on them, because if you hate them, you're afraid that people are going to know them, and then you're going to see you having them, and then you're going to be afraid that you're going to be found out, and then that whole imposter syndrome comes in. And you see, guys, if you notice what I'm doing here, okay, if you notice how I can go from one person to another and go, this kind of work is very complex. That's how I can remember Diego and Dennis and other people who said something weeks ago. Because when you do this long enough, you learn how to hold information a certain way and feed it back to people. This is why you guys have heard me say over and over, these unlicensed, untrained self-helpers who are putting these theories out as a broad way of just trying to help everybody are doing more harm than good. Because it's like me getting on here and saying, well, look, I had a brain tumor and now I'm going to teach you how to do brain surgery. Brain surgery is analogous to the work we do. It is incredibly complex. It's incredibly subtle. The nuances involved in this, I've got to constantly be gauging feedback from my client when I'm talking about their trauma. Trauma. So getting back to Melissa, I bet there's some trauma going on with you that's happening with your insecurities, meaning that mono. Interesting. Great. Thank you for the, please, Mono, share this. Okay. If you think it's interesting, please share this on wherever you're watching this so people can be brought into this, because the reason I'm doing this Monday, Wednesday, Friday, 9 p.m. Mountain is to start normalizing conversations about mental health. Mental health, there is nothing wrong with having a degree of mental illness, nothing. So what I'm wondering with Angie here is that, Melissa, is that Melissa's got insecurities. She's not dealing with them. Maybe you were teased. Maybe you were bullied. Diego talked about his dad. If you guys were in the same house with that type of father or your mom or whatever, maybe you were being put down a lot. Maybe you saw this growing up. You got to work on those insecurities, Melissa. Okay. You got to be able to say to yourself, yeah. And you heard me say this to Severina before. You got to say to yourself, you got to take an it's okay pill and say, you know what? It's okay that I have these insecurities. It's okay. I talked about this in a previous show. I used to be riddled with insecurities growing up. Anybody knows from me in high school, hated myself. Why? Teased a lot about my mixed ethnicity. Didn't help that at home, nobody was talking about the black component in me. It was all like, hush, hush, don't talk about that. So I ingested a lot of that and I grew and I was marinating in self-hate. Thank God I worked on it. I wouldn't be here right now. I wouldn't be doing this. So I know what it feels like to have insecurities. And I still have insecurities, trust me. Anybody got a pill for baldness? I'll gladly take it, as long as there are no sexual side effects. But I would gladly take it. But we all have insecurities, Melissa. You got to be open and talk about them and allow yourself to work on them. Okay. And if it's from trauma, if somebody taught you to hate yourself or to be insecure, you got to own that and work on that. Okay. So let me just scroll down here. Where are you located? I am right now in Northern Colorado. I'm licensed in the state of Florida. I have an office in Florida. The pandemic just crippled I had to close all my offices and relocate, but we're probably going to be moving back at some point. But I do a lot of online therapy. I do a lot of online work with people. Yuri, I don't know what's going on. Yuri, why don't you ask me a question, man? What's going on with you? Share something that you want to work on. So great. People are giving, Angie's talking to Severina saying, people have told me that by staying in an abusive marriage, I am in turn abusing kids as well. Oh, great. And, Angie, nobody should be telling you that kind of crap. Like you don't know that, right? That's a news flash for you, right? Somebody's going to tell a woman in an abusive relationship, "Oh, staying in an abusive marriage is bad for the kids too." Gee, news flash, huh, Angie? You didn't know that. I swear, I know that a lot of people try to help people, but that is the absolute worst. All you're doing, and let me guess, Angie, if you're still on, adding guilt, that helped you, huh? That level of guilt that you were carrying didn't really, I'm sure, help. But anyway, I know people mean well, but they don't understand a lot of times the dynamics of why people are staying in an abusive relationship. So, hey, Amanda's saying to Severina, I just got out of a 5-year relationship as well. Felt like I just completely lost myself for years. Sure, growth and healing will take time, but it's worth doing. Absolutely. Absolutely, Amanda. It is worth doing. It is absolutely worth doing because healing is always possible. Everyone can still heal. Okay. People who say people don't change are the ones or they're just projecting outward that they can't change. Don't let people's pessimism and negativity about your ability to heal keep you stuck. Okay. That's abuse, number one. So let me just go down here for a second. Severina's saying, Melissa is saying, yes, I was cheated by my kid's father about 6 years ago. Well, that's definitely going to affect your insecurities. Please, guys, share this if you're watching this or if you're new to this broadcast. Please, we need to normalize conversation. I love the way how open everyone is because there's nothing to be ashamed of. There's nothing. Everyone has issues that they're dealing with. And if we as a society could come to terms with that, maybe we'll start being a little more compassionate to people. Maybe when somebody gets in your face in a line, you'll just say, "Oh, okay, this dude, I'm not about to touch you or fight you." But we need to be a little bit more compassionate that everyone, yes, to the guilt. It became overwhelming. Exactly. So, Melissa, if you were cheated on by your kids 6 years ago, cheated on by the father of your kids 6 years ago, then I'm guessing that, you got trust issues now. With a future relationship, or maybe you do, or maybe you don't, but you got to work on that. You got to remember that not all men cheat. Not all men are going to hurt you. If you fall into that pessimism, then you're going to stay stuck and you're going to probably get more and more depressed. Okay. So yes, Severina's saying, yes, frustration when my little girl cries because her daddy's actions. It has been more than a year without him. Wow. Yeah. He uses us to disparage when other people were in his life. He literally just came back to have pictures with the kids and convince others about being a good daddy. Yeah, that's tough. That's difficult. What I would recommend for you, Severina, is you got to talk to your daughter now. You got to let her know that she's going through a traumatic event and that she has the power to manage how this is affecting her. People think it's better to shield kids from things and not tell them things. Nothing could be worse. Keeping a kid in the dark. Think about your own childhood. Think about how if one of your parents had come in and said, "Oh, Severina," or "Oh, Melissa, mommy and daddy just got some issues and we don't want you don't have to be like us," and gave you some context, that would have blown me away. If somebody had walked into my room when I was a kid and said, "Hey, Stevie boy, we see that you're struggling with your culture, your ethnic identity. We just wanted you to know we're sorry." That would have blown me away. I would have been like, "Huh?" But none of that shit excuse my language. None of that stuff happened. I was left alone, and thankfully, I worked on a lot of that. There are members of my family who were exposed to the exact same thing, who have never worked on it and are literally still stuck in that pain and then thinking that they're not in pain. Anywho, I'm not saying I'm better than anybody. All I'm encouraging everybody to do is talk about what's going on. I talk openly and freely about my own self-work because I'm proud of it. I'm proud of it. Like I used to be in a lot better shape. When I was in better shape, I was proud of my body. I'm proud of the self-work I've done, so I can talk about it without shame that I went through it, because this is what I draw on to try to help other people. So I'm glad that you guys are interacting with each other and realizing this is a common problem. This is why people drink. This is why antidepressants and anti-anxiety medications are just proliferating. The opioid epidemic. Hating pain. I can't handle pain. I can't deal with any pain. And doctors fuel it by, they say, don't feel any pain. This is, I have physician friends and I beg them, please don't tell your patients after an operation, keep taking this pill and don't let yourself feel any pain. You've got to feel the pain in order to find out how much pain you can manage. I had to have a tooth pulled out, and the dude told me, the dentist gave me all these prescription pills and told me, no, take them immediately afterwards because you don't want to. I'm like, in my mind, I'm like, okay, dude, I waited after the surgery. Yes, it hurt like a mother, but I was able to manage it with Motrin. I was able to manage it with some other techniques I have about managing pain psychologically. Never had to take the medication. Opioid epidemic is being fueled by, guess who? The pharmaceutical companies want us to believe, and I'm not saying all conspiratorial, we need to start looking at pain differently. Whatever pain you guys are in, you got to start accepting it and using it. You got to start embracing that pain and saying, what is this pain trying to teach me? Okay? So Severina's saying, yes, I do. I empower her and tell her what a wonderful thing she is capable, and let her know that she can ask with confidence, that she will have a real answer. Beautiful. Beautiful. What I would recommend also, Severina, is future pace her, meaning put her into the future. Tell her things like, honey, this is going to help you grow. This is going to help you learn what to avoid in relationships. Try to help her frame the trauma as something that she's going to draw on as an adult. I've worked with kids who have been savagely traumatized. And one of the things, after we create a bond and we're working, one of the things I try to help them do is make a decision about how they want this trauma to affect them downstream. And I know it sounds easy, but it ain't. When you're working with a trauma victim, it's very, it's very difficult. So, Diego is saying, yes, my life was built on that, but I realized that I was my parents' guilt, not mine. Beautiful, Diego. Beautiful, bro. Translate that into whatever you're working on with the substance abuse. Start telling Diego, I don't need no friggin' alcohol. I don't need no alcohol to deal with what's inside of me. I don't need no alcohol alcohol. Look at beer commercials, people, and you'll see the conditioning, this idea that all they show you is, oh man, all the beautiful, they don't show you the flip side to that. Okay. So let me just make sure I got to everybody who asked a question. Oh, Melissa asked, what about anger issues? I was just told that I may have a problem. Excellent, Melissa. Thank you. This is what I said before. I'm guessing you're angry that you have insecurities. I'm guessing that you're angry you were hurt. I'm guessing that maybe you're angry at men looking at them like scrub, or you're not going to hurt me. So whatever, if you've got to look at anger as a sickness, as an illness, as a pain in you that needs to be worked on. Anger, but believe me, anger is embedded in us because it helps us survive. A lot of these negative emotions we feel, people, by the way, are biologically hardwired into us because they helped us survive. If we didn't have anxiety, if we didn't have fear, we would never have. We would be. This planet would be rid of humans. And some people would say that would be great for the planet. But think about anxiety, fear. Think about Neanderthal man walking through the jungle or wherever they are, and they have no fear. What's going to happen to them? Exactly. They're not going to last long. Fear is a needed, anxiety are needed emotions for survival. But the problem is, they get so amped up now where they're just out of control. So if you, Melissa, if you feel you have some anger issues, you got to accept it. You got to say to yourself, look, it's okay. I got anger issues. Maybe you saw a lot of anger growing up. Maybe you and Diego should get together and talk about, geez, man, what kind of crap were we learning as kids? I mean, what was that? So, you got a good ally in your brother because you guys are both starting to wake up and work on your issues. You guys should talk it out. I wish I had that. I wish I could do that. But so find out how you both got conditioned to look at things a certain way. So Sabrina saying she explained to her daughter that the only life we can have control of is our own. Yes, but remember, Severina, we don't want to stigmatize feeling out of control because then that gets people away from negative emotion. And if you're new to this broadcast, but you've heard, people have seen me before, I hate, kidding, I don't hate it, but I strongly dislike this whole let it go movement. Okay. This whole let it go movement of let go of your pain and let go of your negativity and all that. That is the last thing we should be doing. We need to get into our pain. We need to get into what's bothering us and work on it and deal with it. Letting it go, like I've always said, let's go with the lesson that it comes with. So Diego is saying, we have doctor, and that's why I brought her here. Beautiful, man. Beautiful. Well, good, people. This was good tonight. Please share this. It'll be up on my Facebook page. If you're watching on Twitter, there was somebody who was questioning me, but didn't ask a question. I think it was Yuri. Yuri, next time I'll be on Wednesday night. Great. Melissa and Diego obviously are close, which is nice. Please ask a question if you're catching this. Severina saying you're totally right. Thank you. So thank you, Severina, for sharing tonight. Thank you, everybody. Please share this. Please talk about this. The thing I'm trying to do, I'm going to start having some guests on soon, where they're going to be providers in the field. They're going to be other licensed. I want to have, if any of you want to be on and we can do a little live therapy back and forth and give people an idea, shoot me. Here is a phone number you can text me on, and we can try to coordinate something like that. But the main thing I will leave you guys with is that it's okay to have issues, but we got to work on them. And what you all did tonight and just talking openly about what's on your mind and what's hurting you is how we heal. This is how we heal. I've got a YouTube video up that I did 4 or 5 years ago on how to heal emotional wounds. And it's the idea that if you had a physical wound and you don't work on it, it's going to get infected. It's the same thing with emotional wounds. Okay. So thank you everyone for tuning in. Again, please share this if you know anyone that could help. That could help. And I'll see you guys again Wednesday evening, 9 p.m. Mountain. And let's keep healing, people, because we need it. Everybody who's working on their issues is making the world a better place. Think about it. If we are working on the things that are causing the world to be the way it is, it's all emanating from within here. So you working on yours is you saying, I'm going to do what I can to make the world a better place. All right, guys, thanks a lot. Catch you Wednesday night. Take it easy.